Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. How can I assist you today?
Good morning, doctor. I've been having these patches on my skin that are red, itchy, and covered with silvery scales. I'm quite concerned about it.
I see. How long have you been experiencing this?
I first noticed them about 3 months ago, but they seem to be spreading and becoming more prominent recently.
Which areas of your body are affected by these patches?
They started on my elbows and knees, but now they're also on my lower back and scalp.
Are these patches always itchy, or do they sometimes become painful?
They're mostly itchy, but sometimes they do feel sore, especially when I accidentally scratch them.
Have you noticed any factors or triggers that might exacerbate the condition, like stress, specific foods, or environmental changes?
Stress seems to make it worse. I've also noticed that the patches get more inflamed after I have a hot shower.
Do you have any other health issues or conditions?
I've had occasional joint pains in my fingers, but I thought it might be due to overworking.
Interesting. Have you ever tried any treatments or remedies for these skin patches?
I've been using moisturizers and some over-the-counter creams, but they provide only temporary relief.
Do you smoke or consume alcohol?
I drink occasionally but don't smoke.
Any family history of similar skin conditions or other autoimmune disorders?
My mother had similar patches, and she was told it was psoriasis.
Based on your description and family history, it does sound like psoriasis. However, a proper examination will help confirm this. Looking at your records, your blood tests indicate elevated inflammatory markers, which can be consistent with psoriasis. Your skin's physical examination shows thick, red patches covered with silvery scales, typical of plaque psoriasis. Do the patches on your scalp cause dandruff-like flaking?
Yes, doctor, it's been quite embarrassing as it looks like severe dandruff.
I understand your concerns. Psoriasis is a chronic autoimmune condition that can be managed effectively with the right treatment. I'm prescribing a topical steroid cream to reduce inflammation and itching. Additionally, a medicated shampoo for your scalp will help control the flaking and itching. Given your joint pains, I also recommend seeing a rheumatologist, as some people with psoriasis can develop psoriatic arthritis.
Thank you, doctor. Is there anything else I should be aware of, or any lifestyle changes I should make?
Keeping your skin moisturized will help. Avoiding triggers like stress and reducing alcohol consumption can also benefit. Remember, while there's no cure for psoriasis, with proper care and treatment, we can manage the symptoms effectively. Regular checkups will also be essential.
I appreciate your guidance, doctor. I'll start the treatment and schedule a follow-up visit.
You're welcome. Take care, and if you have any concerns or worsening symptoms, don't hesitate to reach out.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Dr. Lewis. I've been referred to you because my family doctor suspects I might have emphysema. I've been struggling with shortness of breath and a chronic cough lately.
Hello, Mr. Thompson. I'm glad you came in. Emphysema is a type of chronic obstructive pulmonary disease, COPD. Tell me, have you been a smoker?
Yes, I smoked for about 30 years, but quit around 5 years ago.
That's good to hear that you quit. Emphysema is often linked to long-term smoking. How often do you experience shortness of breath?
It's been quite frequent, especially when I try to exert myself. Even simple tasks like walking upstairs or carrying groceries make me feel winded.
I see. And the cough you mentioned, do you produce any sputum or mucus?
Yes, it's usually clear or white. Sometimes there's a lot, especially in the mornings.
Do you have any history of frequent lung infections or other lung diseases?
I had pneumonia twice in my life, and when I was younger, I used to get bronchitis quite frequently.
Noted. What about your family history? Is there any record of lung diseases, particularly emphysema, in your family?
Not that I'm aware of.
Okay. Given your history and symptoms, we'll need to run some tests to confirm the diagnosis. We typically start with pulmonary function tests to see how well your lungs are working.
What do those tests involve?
We'll measure how much air you can breathe in and out and how fast you can exhale. It helps us determine any obstruction in your airways.
All right, and when will I know the results?
Usually within a few days. Depending on the results, we might also suggest a chest X-ray or CT scan to get a clearer picture of your lungs.
I see. If I do have emphysema, what would the treatment options be?
Treatment aims to relieve symptoms and slow the progression of the disease. This could include bronchodilators to open the airways, inhaled steroids to reduce inflammation, and oxygen therapy if your blood oxygen levels are low. In some cases, pulmonary rehabilitation or even surgery might be options.
Will I need to be on medication for the rest of my life?
It's likely yes. Emphysema is a chronic condition, and while we can manage the symptoms, there is no cure. But with the right treatment and lifestyle changes, many patients lead active and fulfilling lives.
Thank you, Dr. Lewis. I appreciate your thoroughness.
It's important to understand your condition and the options available. We'll work closely with you throughout. For now, let's schedule those tests and go from there.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Have you tried the new motion capture technique for gait analysis?
I haven't yet, but I've been reading about it. It seems to give real-time feedback on gait abnormalities, right?
Precisely. It's fascinating. We can now get a 3D representation of the patient's movement and identify even subtle deviations from the normal gait.
That sounds promising, especially for our post-stroke patients and those with sports injuries. But is it easy to implement?
There's a bit of a learning curve, especially with placing the sensors accurately, but once you get the hang of it, it's a breeze. It's such a game changer in creating tailored rehab plans.
Now look at question 26.
Have you noticed the shortage of the standard pain relievers on the shelves lately?
Absolutely. It's been challenging. I think there was some disruption at the main supplier's end. We've had to resort to alternative brands.
That's what I've been doing too. But it requires extra caution, especially when dispensing to patients with known allergies. Different brands sometimes have different excipients.
True. And it's not just about allergies. We need to educate patients about the change, especially when the appearance of the medicine is different. The last thing we want is for them to be confused or concerned.
I couldn't agree more. Patient safety and education always come first. Hopefully the supply chain issues get sorted out soon.
Now look at question 27.
Good afternoon, everyone. Patient confidentiality is a fundamental right and a cornerstone of the doctor-patient relationship. It's paramount that all health practitioners understand the importance of keeping patient information private.
Absolutely. When patients come to us, they trust that their personal and health information will be kept confidential. Leaking or sharing this information without proper consent can lead not only to legal repercussions, but can also break the bond of trust. It's essential for maintaining the integrity of our profession.
Indeed. Moreover, electronic health records are becoming more common these days, and the risk of breaches is higher than ever. Everyone in this room needs to ensure that they follow proper protocols to safeguard this data.
Yes, and beyond just the technical side, we should always be wary of discussing patient cases in public areas, even in the break room. You never know who might be listening.
Now look at question 28.
Mental health issues are becoming increasingly prevalent, and as healthcare professionals, we need to be adequately equipped to recognize and address these challenges in our patients.
That's right. It's not just about recognizing these issues in patients. We also need to acknowledge and address them in ourselves and our colleagues. The healthcare field can be stressful, and it's vital that we take care of our mental well-being.
Absolutely. Burnout, anxiety, depression, these are real challenges that many in our profession face. By understanding and addressing them, we can provide better care to our patients.
And let's not forget, communication is key. If you're struggling or see a colleague struggling, it's crucial to open a dialogue, seek support, and ensure that mental health is treated with as much importance as physical health.
Now look at question 29.
Did you manage to attend the pediatric nutrition seminar last week?
Yes, I did. I found it particularly enlightening, especially the section on micronutrient requirements for infants.
I agree. It was quite detailed. I appreciated the emphasis on vitamin D and iron, especially given the prevalence of deficiencies in those areas.
Right? I also thought the discussion on the challenges of ensuring adequate nutrition for picky eaters was spot on. It's a real concern for many parents.
Yes, and offering those practical strategies on how to incorporate essential nutrients creatively in their meals was a nice touch. Parents are always looking for ideas.
Now look at question 30.
Dr. Mitchell, I've been going over the notes from our recent surgery on the patient with the abdominal mass. The approach we took was different from what I learned in medical school.
Ah, you're referring to the minimally invasive technique we used.
Yes, exactly. I've mostly seen the traditional open surgery for such cases.
Minimally invasive surgeries have their advantages, especially in terms of quicker recovery and reduced postoperative pain, but they do require a different skill set.
I noticed the precision required, especially with the laparoscopic tools. It seemed challenging.
It takes some getting used to, but with practice, it becomes second nature. It's always good to be versatile and learn both techniques. Depending on the patient and situation, one approach might be more beneficial than the other.
I see. I'll definitely want to practice more on the simulator before attempting another one.
That's the spirit. It's all about continuous learning and adapting.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Hello everyone, my name is Dr. Evelina Houghton, and today I'd like to shed light on a significant health issue, chlamydia. This sexually transmitted infection, or STI, affects millions of people worldwide every year, and understanding its intricacies is crucial in both prevention and treatment. Chlamydia is caused by the bacteria Chlamydia trachomatis, and is often referred to as the silent infection because of its ability to remain asymptomatic in many individuals. This means a large number of those infected may not even be aware they have the disease, increasing the risk of transmission and potential complications. For those who do exhibit symptoms, they can range from mild to severe. Women may experience abnormal vaginal discharge, burning sensations during urination, and pelvic pain. Men, on the other hand, might notice discharge from the penis, burning and itching around the opening of the penis, or pain and swelling in one or both testicles. If left untreated, chlamydia can lead to serious health issues such as pelvic inflammatory disease in women and epididymitis in men. The prevalence of chlamydia and its asymptomatic nature underscores the importance of regular screening. The Centers for Disease Control and Prevention recommends annual chlamydia screening for all sexually active women under the age of 25 and older women with risk factors such as new or multiple sex partners. Prevention is paramount. Safe sexual practices, including the use of condoms and limiting the number of sexual partners, can significantly reduce the risk of contracting or spreading chlamydia. Education about the infection, its transmission routes, and potential consequences is also a powerful tool against its spread. Treatment for chlamydia is straightforward once diagnosed. Antibiotics such as azithromycin and doxycycline are effective in treating the infection. However, it's imperative to complete the entire course of treatment even if symptoms disappear before the medicine is finished. Moreover, retesting a few months after treatment is vital, as reinfection is common. It's essential to inform all recent sexual partners about a chlamydia diagnosis so they can seek testing and treatment if necessary. This collaborative approach can curtail the chain of transmission and protect the wider community. In conclusion, chlamydia, while common, is preventable and treatable. Regular screenings, safe sexual practices, and community education are key to combating this STI. It is our collective responsibility, both as healthcare providers and members of society, to be aware, informed, and proactive in addressing this and other sexual health matters. Let us prioritize our health and the health of our partners by staying informed and taking appropriate preventative measures.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, everyone. My name is Dr. Maria Gonzalez, and I am an infectious disease specialist working primarily on vector-borne diseases. Today, I want to dive into the topic of the Zika virus, and more specifically, share the story of a young woman, let's call her Isabella, who had a first-hand experience with it. Through Isabella's journey, I aim to shed light on the intricacies and challenges of dealing with Zika. Firstly, some background. Zika is primarily transmitted through the bite of an infected Aedes mosquito, especially the Aedes aegypti. Historically, it was considered a mild infection, with most people showing no symptoms or just having a rash, fever, and joint pain. However, concerns rose globally when it was linked to severe birth defects and neurological complications. Regions like South America, especially Brazil, saw significant outbreaks between 2015 and 2017. Now, let's talk about Isabella. She was an adventurous young woman who loved to travel. During a trip to South America, she was frequently exposed to mosquitoes due to her love for hiking in tropical regions. Shortly after returning home, she began to experience mild flu-like symptoms, including joint pain and a rash. Brushing it off as a minor ailment from her trip, she didn't immediately seek medical attention. A few weeks later, however, she became alarmed when she began to experience more severe symptoms, like intense joint pain and red eyes. It was around this time she found out she was pregnant. She immediately contacted her doctor with her concerns. Considering her recent travel history, the physician ordered tests that confirmed she was infected with the Zika virus. Isabella was devastated. Pregnant women infected with Zika have an increased risk of giving birth to babies with microcephaly, a condition where a baby's head is significantly smaller than expected, often due to abnormal brain development. Isabella went through a flurry of emotions and numerous consultations with specialists to understand the risks and implications for her unborn child. Her pregnancy was closely monitored, and through advanced imaging, it was determined that her baby was developing normally. But Isabella's anxiety didn't end there. She remained concerned about potential long-term effects that might not be immediately visible. This emotional journey underscores the importance of awareness and preventive measures against the Zika virus, especially for pregnant women or those trying to conceive. Unlike Isabella, many individuals may not connect their symptoms to a potential Zika infection. Furthermore, the long-term effects on babies born to infected mothers remain a concern. Some children may appear healthy at birth, but may develop issues as they grow. Such stories emphasize the need for dedicated Zika clinics in affected regions. These centers can provide comprehensive care, from early detection and treatment to counseling and support. Building a rapport with patients is crucial, as it can lead to better understanding, compliance with recommended guidelines, and overall improved outcomes. In conclusion, while Zika may not currently dominate headlines, its impact on affected families is profound. It is vital that we remain vigilant, spreading awareness, and ensuring that adequate resources are available for prevention, diagnosis, and support.